This medication, OSCAL 500 Vit D3, is used to prevent or treat low blood calcium levels in people who do not get enough calcium from their diets. It can be used to treat conditions caused by low calcium levels such as bone loss, weak bones, decreased activity of the parathyroid gland, and a certain muscle disease. It can also be used in certain patients to make sure they are getting enough calcium, including women who are pregnant, nursing, or postmenopausal, and people taking certain medications such as phenytoin, phenobarbital, or prednisone. Calcium plays a vital role in the body, necessary for normal nerve, cell, muscle, and bone functioning. If there is not enough calcium in the blood, the body will take calcium from bones, weakening them. Vitamin D helps your body absorb calcium and phosphorus. Having the right amounts of vitamin D, calcium, and phosphorus is important for building and maintaining strong bones. The recommended daily dosage of OSCAL 500 Vit D3 is dependent on individual needs and should be determined by a healthcare professional. It is typically taken once daily or as directed. It is important to take this medication at the same time each day and to follow the dosage instructions carefully. The best time to take OSCAL 500 Vit D3 is usually with a meal to help with absorption, but it is important to follow the specific directions given by your healthcare provider. Be sure to discuss any concerns or questions about the timing and dosage of this medication with your doctor or pharmacist. When taking OSCAL 500 Vit D3, it's important to remember to take it with food. If your product contains calcium citrate, you can take it with or without food, but be sure to follow the directions on the product package or as directed by your doctor. For best absorption, if your daily dose is more than 600 mg, it's best to divide the dose and space it throughout the day. If you're using the liquid form, be sure to measure the dose carefully using a special measuring device or spoon. For the chewable form, chew thoroughly before swallowing, and for capsules, swallow each one whole. It's important not to crush or chew extended-release tablets, as this can cause all of the drug to be released at once, increasing the risk of side effects. Take the whole tablet without crushing or chewing. Using this medication regularly is key to getting the most benefit from it. Try to take it at the same time each day to help you remember. If your doctor has recommended a special diet, it's important to follow it to get the most benefit from the medication and prevent serious side effects. Also, do not take other supplements or vitamins unless ordered by your doctor. Calcium supplements come in different forms with different amounts of calcium and vitamin D, so be sure to ask your doctor or pharmacist to help select the best product for you. If you believe you have a serious medical problem, seek medical help right away. If you experience constipation or stomach upset while taking OSCAL 500 Vit D3, it's important to tell your doctor or pharmacist. However, many people using this medication do not have serious side effects. Contact your doctor right away if you experience any of the following serious side effects: nausea/vomiting, loss of appetite, unusual weight loss, mental/mood changes, signs of kidney problems, such as change in the amount of urine, bone/muscle pain, headache, increased thirst, increased urination, weakness, tiredness, or fast/pounding heartbeat. Although very rare, if you notice any symptoms of a serious allergic reaction to OSCAL 500 Vit D3, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so it's essential to contact your doctor or pharmacist if you notice any other effects. And always follow your doctor's instructions for the best time to take this medication and the appropriate dosage for your specific needs. Before taking OSCAL 500 Vit D3, it's important to inform your doctor or pharmacist if you have any allergies to vitamin D products or any inactive ingredients in the medication. It's also crucial to share your medical history, especially if you have high calcium/vitamin D levels, difficulty absorbing nutrition from food, heart/blood vessel disease, kidney disease, certain immune system disorders, liver disease, certain bowel diseases, or low levels of stomach acid or bile. If you are diabetic or have phenylketonuria, it's important to use caution with chewable tablets that may contain sugar or aspartame. For pregnant women, it's best to use doses of vitamin D greater than the recommended dietary allowance only when clearly needed, and to discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before taking this medication. As for the daily usage, the recommended dosage and the best time to take OSCal 500 Vit D3 should be discussed with your doctor. It's important to be aware of potential drug interactions with OSCal 500 Vit D3, as they can affect how this medication works or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with OSCal 500 Vit D3 include digoxin and phosphate binders. Calcium can decrease the absorption of other drugs, so it's important to separate the doses of OSCal 500 Vit D3 from medications such as tetracycline antibiotics, bisphosphonates, levothyroxine, and certain antibiotics. Additionally, certain medications can decrease the absorption of vitamin D, so it's important to talk to your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. It's also important to check the labels on all your prescription and non-prescription products, as they may contain calcium, phosphate, or vitamin D. And be sure to avoid using medications containing calcitriol while using vitamin D. Lastly, OSCal 500 Vit D3 may interfere with certain lab tests, so make sure all your healthcare providers are aware that you are taking this product. If someone has taken too much OSCal 500 Vit D3 and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call 1-800-222-1222 to reach your local poison control center. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, changes in mental state, headaches, drowsiness, weakness, and tiredness. Remember to schedule regular medical tests to monitor your calcium levels while taking OSCal 500 Vit D3. It's important to keep all medical appointments and consult your doctor for more details. You can also increase your intake of vitamin D by consuming fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and fatty fish. Additionally, your body can produce vitamin D when exposed to sunlight. To boost your calcium levels, consider consuming dairy products like milk, yogurt, cheese, and ice cream, as well as dark green leafy vegetables such as broccoli, spinach, and bok choy. You can also opt for calcium-fortified foods like orange juice. In addition, engaging in physical activity, avoiding smoking, and limiting alcohol and caffeine intake can help reduce the risk of bone disease. Remember to follow the recommended daily dosage of OSCal 500 Vit D3 and consider the optimal timing for taking this medication. If you happen to forget to take a dose of OSCal 500 Vit D3, just take it as soon as you remember. But if it's close to the time of your next dose, then it's okay to skip the missed one. Just continue with your regular dosing schedule and do not take double the dose to make up for the missed one. When it comes to storing OSCal 500 Vit D3, it's important to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. It's crucial not to flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When the product reaches its expiration date or is no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.